So, a quick summary of the second article. It talks about Leapfrog Group's CPOE system, which is the computerized physician order entry system designed to streamline medication ordering. And it was designed to improve patient safety by reducing legibility issues. The article talks about how the system fails to report 39% of potentially harmful orders and 13% of fatal orders. It also talks about the lack of improvement within the previous 5 years from the time that the article was written. Hospitals do have medication reconciliation processes and measures of accountability in place, but overall, the article talks about the lack of keeping the CPOE systems up to date and the inefficiency of the system.
Hi everyone, my name is Priscilla Fan and I'll be speaking a little bit about this week's article about the application of EHR in healthcare settings. So, as we all know, EHR stands for Electronic Health Records, and EHR is used in healthcare settings to create a database of patient services, lab tests, visits, medical history, and much more. In this day and age, almost every aspect of our life has some sort of technological advancement to it. We have watches that collect our daily steps, alarm clocks that measure our typical sleep cycle, and way more than I can explain. Instead of collecting every patient's data on paper and keeping that on file in a hospital or clinic, EHR is used to make both the life of the health provider and a patient easier. With EHR, a provider is able to see the healthcare trends of their patients and can offer health-related suggestions and prevent illnesses rather than waiting to treat a problem when it arises. EHR is very beneficial in healthcare settings because more than just a physician is able to see the health trends of a patient. For example, EHR allows an administrator to obtain billing history or a researcher to see the effectiveness of a medication. One aspect of this article that I would like to speak more upon is the future vision of EHR. Although healthcare providers can access a patient's database, it would be even more helpful if they could see other aspects of the patient's health record besides the one that they have at their current office or so. The article mentions the integration of different fields to use EHR and improve it with the Nationwide Health Information Network. This network would integrate different systems that would further improve the quality and efficiency of EHR by including new vocabularies or connecting clinical research centers or public health officials to gain access to data that about a population or a patient or a community or so. The integration of more fields that are able to access health records can also lead to certain biomedical engineering companies that can see rising health trends and create new products that would help increase like a patient's or just a community's quality of life or so. Thank you.
Hello, Danny here. This week's topic is about electronic health records and computerized physician order entry systems. The first is a system that allows healthcare records to be organized into digital format. The first reading elaborates upon the general applications of EHR, its benefits, and future prospects of electronic health records. This offers higher accessibility and easier documentation of records. However, with new technology comes new challenges and hurdles to overcome. The second article elaborates upon possible downsides and dangers of computerized physician order entry systems. This is a system that allows physicians to order medications directly from the manufacturer. My colleagues will further elaborate upon and discuss the two articles.
The article mentioned that without accelerated improvement of computerized physician order entry systems, patients will continue to receive medications or dosages that increase their risk of injury or death. Based on what we have learned about the opioid crisis, we know that one of the main factors related to opioid addiction is the increased number of prescriptions being written for opioids. Improving computerized physician order entry systems could help reduce the number of medication errors and thus reduce the rate of patients being overprescribed for opioids. It's also mentioned that too many alarms can lead to alert fatigue, causing physicians to tune out warnings. I understand this concern as the alarms can have a huge impact on the patient's health and safety. However, I also understand that too many alarms can get annoying. In my own experience, I've had to deal with the fire alarm of my apartment complex going off so much to the point where I don't even try to evacuate and just instead listen to music at full volume to drown out the sound and continue doing what I was doing before the alarm. Because of alert fatigue, computerized physician order entry systems definitely need to find that healthy middle where alerts aren't given for every single medication error that happens if it isn't dangerous, but instead when the medication error could result in an injury or death. Thank you.
An electronic health record, or EHR, is a proposed solution to some of the several healthcare problems such as high costs, inconsistency, and accessibility that we face today. They increase efficiency, reduce costs, and are consistent. For example, every time I go to the doctor, I notice that the nurse will ask me a variety of questions and input them on the computer. After the nurse leaves, my doctor will come in and read my file. I can see here how EHR can make healthcare visits more efficient every time I visit. Something I didn't think about was the long-term storage of these health records. EHRs must be ensured to be compatible with future technology retrieval systems while still physically and virtually remaining secure because of the sensitive information they contain. I think that the use of EHRs will continue to be extremely beneficial to healthcare offices and hospitals throughout time as long as the security of them is preserved. Professor Jacob M. Appel claims that due to the mass amount of people who would need to have access to this type of system, a breach on privacy will occur at some point. This is a disadvantage of using EHR. With this said, if supreme cybersecurity can be achieved, I think storing this information in a universal fashion, such as on the cloud, so that EHRs can be easily transferred from office to office would be beneficial, especially to be able to easily and instantly communicate with pharmacies.